watching East Midlands Today, and next tonight we look at the work of nurses, specifically at the role of community nurses as they deliver more care in patients' homes instead of in hospital.
Well, that shift from hospital to home is one of the big aims of the NHS's new long-term plan. Our health correspondent Rob Sissons has met one community nurse who is helping to lead that change. She's training colleagues to support more patients.
Sue's worked in community nursing for over 30 years. With an ageing population and the NHS aim to end an over-reliance on hospitals, the sector's expected to expand. Today, she's in Whetstone.
Where else would you have a job where no 2 days are the same? And it's just fantastic. You go into patients' houses, you never know what you're going to see behind the closed doors.
Ian has been treated for bowel and liver cancer. Only a few years ago, chemotherapy would be done entirely in hospital. More and more skills, though, are being added to the community nurse's role.
It adds to our skills, obviously, but for the patient, brilliant. They carry on normal activities. You can do most things, can't you?
That's obviously better for the patient because for travel reasons, and getting to the hospital, hospitals are busy, and everybody trying to flood the hospital for minor things like PICC lines is not conducive to a good service.
Things have got more complex. We've taken on new tasks, and Sue gets involved if we require any kind of training for those. So, yeah.
The health service needs more people to follow in Sue's footsteps. Her nursing director says there's fierce competition, though, for nurses.
We've always had vacancies, we've always had shortages, but we're encouraging now through different routes. So we have now apprenticeships, we have nursing associates.
The NHS plan now to beef up community services, and Sue can see the logic.
It was always seen as very much an invisible service. I think we're now raising our profile a bit more, and it's becoming a lot more topical because they're realising that what we do out in the community is really, really valuable.
And as a valued nurse, she was recently named a Queen's Nurse. That's a prestigious national award that recognises years of service. Rob Sissons, BBC East Midlands Today, Leicestershire.
Now, next on the